Get your mom. All right, ladies and gents, today we're going to talk about the deep dorsal muscles. So this means continuing our conversation of back muscles, but these are the muscles that are below your trapezius and below your latissimus dorsi. Right, they're going to be deeper dorsal muscles. So there are quite a few that we're going to go through here on your sheet. So you need to follow along again as we discuss each of these muscles. Okay, so the first muscle we're going to discuss is called the levator scapulae. So its name is actually very helpful when you think about its description. In the name, we're going to know what the action is going to be. So any levator muscle is a muscle that elevates. So in this case, if it's the levator scapulae, its action is going to be to elevate the scapula. The levator scapulae, it's going to originate on the transverse processes of the first 4 cervical vertebrae. So if you look here, here's the levator scapulae in red. Right, it's actually going to go up here into this part, and that's where it's going to originate. So you're going to have to know all of that part for the origin. It's insertion, vertebral border of the scapula. Okay, so here's the scapula. When it talks about vertebral border, what it means is the medial border. Okay, so we talked about this being one side of the scapula, so the medial side, and it's actually very close to the top of the scapula. So levator scapulae, it's a deep muscle. It's pretty hefty in size, right? And its main job is to elevate the scapula. So that's the action that you need to know, is elevate scapula. All right, this muscle, serratus anterior, it should look familiar, right? It's one that we've talked about already. So we talked about it as being a front muscle up here. It's got the serrations on it. So serratus because of the serrated edge, anterior because it's in the front. The reason why we're talking about it again here is because it's also deep in dorsal, right? It goes all the way to the back. Okay. With this serratus anterior, again, anterior and superior margins of ribs 1 through 9. Okay, so that should be a review. And insertion, anterior surface of the vertebral border of the scapula. So you need to know both origin and insertion as full. Action, so when it functions, it's going to protract the scapula, right? Bring it that way. And it's going to adduct and medially rotate the scapula. Okay, so it's going to bring the scapula into, so protraction here, all right, and the medial, it's going to move it towards the medial side. So abduction moving away, medial rotation, it's going to go outward. All right, this next one. So your book has it listed a little bit differently. It's a group of muscles called the rhomboidus muscle, and there are 2 parts to it, the major and the minor. So I grouped the 2 together. So rhomboid major and rhomboid minor, both of these muscles are important with moving the scapula. And you guys have actually felt these when you guys have been feeling your cat muscles, so those deep ones when you're finding the serratus anterior actually pressing on the rhomboid muscles here. So the rhomboid major and minor. All right, so the reason why I'm talking about them together is that they have very similar origins, insertions, and actions. Okay. So the origin, spinous process of the lower cervical and upper thoracic vertebra. So it begins here. So rhomboid major and minor are all beginning along the vertebra here on the transverse processes. Its insertion, vertebral border of the scapula. So the way this works is it's going to go onto this part of the scapula. And its actions include adduction of the scapula and rotation laterally of the scapula. So the rhomboid muscles, the reason why they're called the rhomboids is because when you put them together, they look like a rhomboid, right? That's, the shape of a rhombus. So it's like a off-kilter square, right? So they have the same size on each side, same length, similar to what we're seeing with the rhomboid here. All right, so like I said, with major and minor muscles, the rhomboid major is going to be larger. And in this case, the major and minor muscles are actually flipped. Usually the major muscle is going to be more superior. In this case, the major muscle here is actually a little bit more inferior in comparison to the rhomboid minor. So the minor is smaller, rhomboid major is much larger than the minor muscle. So that pattern follows through. But the superior-inferior pattern that you would expect to see is actually flipped on the rhomboidus muscle. All right, these next muscles, okay, some of these muscles, I'm going to describe 5 of them. 4 of these muscles are a part of a group that we call the sits muscles. So supraspinatus, infraspinatus, teres minor, and subscapularis. These 4 muscles are important in your rotator cuff. All right, so the motions of your shoulder here. Okay, so these rotator muscles are the reason why I talk about them separately like this and reference sits is that these are the most commonly injured muscles in the human body. The reason why is that if you throw something, lift anything, move your arms, do any of that stuff, you're going to be working one of your sits muscles. Okay, so we'll talk about each of them in their groups. I'll highlight them here on the pictures. Supraspinatus. Okay, so supra means above or up. So supraspinatus, its origin is in the supraspinous fossa of the scapula. So again, these names are related. So supraspinous fossa of the scapula is its origin. Its insertion, greater tubercle of the humerus. So what that means is that it's going to go from the supraspinatus here and it's going to insert on the humerus. So with the sits muscles, they're all going to insert someplace over here. Okay. Action. So that's abduction of the shoulder or abduction. Okay, so abduction, remember, if you're taking something that's far away and bringing it closer to, or sorry, you're pulling it away. So abduction is away. Adduction is when you bring it closer. Abduction away. So when your supraspinatus contracts, right, it's pulling on your humerus. So your humerus is going to go up in that direction. Okay, so again, it's one of the sits muscles. So record that in your notes that it's part of your rotator cuff. The next muscle that we're going to talk about is infraspinatus. Okay, infraspinatus, it's going to be inferior to the spine of the scapula. So infraspinous fossa. Remember, a fossa is an indentation underneath a bone. Okay, so some kind of indent right there. So this is below the spine, which is right here. Okay, so infraspinous is below that, infraspinatus. Its insertion, greater tubercle of the humerus. So if we look back, that's the same as the supraspinatus. So remembering if it's a cis muscle and part of the upper part of the humerus, you're going to be good when you're memorizing those things. Rotation. Laterally is its action. So rotate the shoulder laterally. So if you pull on it and you think about it, if that muscle is contracting, right, it's going to rotate your arm to the side. Okay, so if you feel that contraction, it's going to rotate it to the side, right, to the lateral side of your body. Again, one of the sits muscles, so record that in your notes. This muscle, teres major, okay, this is not part of the sits group, all right, but it has similar function, okay, so it's not necessarily total rotator cuff, it doesn't go to the superior part of the humerus here, all right, it's actually going to insert on the intertubercular groove of the humerus. So remember, between your greater and lesser tubercles, you have a groove that comes down here. All right, that side of the groove is where your teres major is going to be. So since it's a major muscle, there's probably a minor. We'll talk about the teres minor here in a second. Again, as a major muscle in humans, the major muscle is larger than the minor muscle. So the teres major is a pretty big muscle. And some of you guys have actually seen this. When you pulled back your serratus or pulled back your muscles after you cut through your pectoralis minor and major on your cat, when you cut through that and reflected that muscle back to see the serratus anterior, some of you guys pointed out that your scapula was still attached. All right, you're actually seeing part of that when you flip that over and look at it. Its origination is the inferior angle of the scapula. So when we talk about the angle of a bone, right, it's a point. So the inferior angle of the scapula is down here, and it's going to insert into the intertubercular groove on the humerus. So again, that sulcus or space between the greater and lesser tubercle on your humerus. Action, adduction and medial rotation of the shoulder. So you can write adduction of the shoulder or medial rotation of the shoulder. So when you pull that, your shoulder is going to come into, you're going to add it to the body. All right, next muscle, teres minor. So like I said, you had a major and minor. Your major muscle, all right, was right here. And it originated over here, and it's inserted onto this point. Next one is your minor. So your teres major is going to sit partially over your teres minor. It's going to originate on the lateral border of the scapula, so in your armpit. That's where it's going to begin, and it's going to insert in the greater tubercle of the humerus. So again, as a sits muscle, they all pretty much end up right there. So if you look here, here's the greater tubercle of the humerus. It's going to attach to this part, this side right here. Action, lateral rotation of the shoulder. So when this muscle works, you're going to move your shoulder outward. So it's going to rotate laterally. So it's going to go to the side. Right, so that's your teres minor. Again, one of the sits muscles, right? It's one of those four, okay, that deals with your rotator cuff, some of the most commonly injured muscles in the body. All right, the last muscle that we're going to talk about in part of the sits group is the subscapularis. So again, it's a sits muscle. It deals with the rotator cuff. Subscapularis, as the name implies, it's going to be sub, so sub means below. Scapula, that means scapularis is below the scapula. So if you look at the origin, subscapularis. So again, I emphasize this. Finding these types of patterns as you're memorizing and looking at these muscles is a great way to memorize them. Finding connections, finding these different patterns are all through anatomy, right? These are all terms you've heard before, right? They're putting them together. If you can break down the word, you're going to help yourself in the long run to memorize all of these different muscles. So subscapular fossa of the scapula, so it's going to be underneath the entire part of the scapula here, so on the underside of it. And a lot of you guys, when you worked with your cats, you actually pressed this muscle when you were pushing away the scapula to see the serratus anterior on the front of your cat. Next one for the insertion, lesser tubercle of the humerus. So again, it's going to insert in this part of the humerus, part of that rotator cuff. Okay. So the subscapularis is a little bit different. The rest of them attach towards the greater tubercle. This is to the underside, okay, to the other side to the lesser tubercle. So it's going to do medial rotation of the shoulder. So when you react to this, you bring your scapula in, all right, and your arm is going to rotate medially towards the inside or midline of your body. So medial rotation of the scapula. All right, these next muscles, these are all more deep back muscles. They have a little bit less to do with the scapula. And the way that some of these work is actually a group of several muscles that carry a similar name, and we're just going to describe the origin, insertion, and action of the entire group together. So I labeled group on your tables. When you look at those are your signal that these are actually made up of several different muscles that all work in tandem. All right, the first muscle that we're going to talk about in this kind of group, so not one of these associated with the scapula, but actually over here, is next to your levator scapulae. So this is going to be medial to the levator scapulae, and this muscle is called your splenius. All right, your splenius is actually several different muscles that all work together, but you're going to group this together. Origin, spinous process of lower cervical and upper thoracic vertebra. So we've had another muscle with that very similar origin. So if you think about this, again, it's going to be inserted in these upper parts. So lower cervical, so about C5 to about T2, somewhere around there is where you're going to have this muscle attached. It's a little bit different, everyone. Insertion, mastoid process, base of skull and upper cervical vertebra. So when you describe insertion for the splenius, because it's a group muscle, you're going to have to know all of it, okay? Insertion, mastoid process, base of skull, and cervical vertebra. So if you look here, mastoid process is over here. Remember, sternocleidomastoid is attaching in that same place, or inserting there. Cervical vertebra, so again, somewhere around C5 to T2, and then base of the skull. So right, it's going to come around here. It's going to go across this occipital projection on the back of your head, right? And you can feel it. If you take your neck and you feel down and press very hard on this back side of your neck here, all right, you can actually feel where that is, okay? It's going to be in this area. The issue here is that you're actually feeling part of your trapezius and some of your levator scapulae in that area. So you're not going to really feel that muscle. It's a little bit deeper to that, but it's in that area. Action. So when the two sides work together, all right, you are going to extend your neck. So if you do that, your neck's going to go up. If you reflect one or the other, your head is going to rotate laterally and flex to the side. Okay. All right, so the last three muscles I'm going to go over in a second video, and then I'm going to talk to you a little bit about some practice stuff that you guys should be doing. Again, remind you to do a couple different things. So we're going to start again with the longissimus group here in this next video.